the American Association of Neurological Surgery, dear auditorium, has asked you, Kurt, to give a survey on the development of German neurosurgery. And it was your idea to give this survey not you alone, but together with both of us. And this one, as you certainly know, is Madjid Sammi, and I am Fritz Loew. But before we start with the development of German neurosurgery, I'm feeling it could be a good idea to present to you first Kurt Schurmann. Kurt Schurmann is born in 1920, and his neurosurgical training has been done with Wilhelm Tonis, starting in 1945 at Bochum. It followed a time at the Cologne University Clinic, at Munich, and later in the 1950s, Kurt, you got the chair of neurosurgery at the Mainz University. Some headlines should be mentioned. You have been one of the vice presidents of the European Association of Neurosurgical Societies in the 1970s. And when you have built up your department here at Mainz, you partly continued the work which had been started already by Tonis on brain metabolism, brain edema, cerebral blood flow, and intracranial pressure. And you established working groups of on these topics. On the clinical point of view, you had special interest in the surgery of the skull base, of the orbit, of arteriovenous malformations, and also on the spine and spinal cord. And it should be mentioned that you have been the first who created an independent department of neuroradiology within the Neurosurgical Clinic, and at the end of your career you created a department on experimental neurosurgery.
Yeah.
Since about 1 year you are retired.
2 years.
2 years, already 2 years. Madjid Sammi has been a pupil of you, and therefore I'm feeling it would be appropriate if you present Madjid Sammi.
Yeah. Madjid Sammi is not only a pupil of mine, he is also a good friend, the best friend of mine. And I am proud of him because he started in 1977 to have his own independence in neurosurgery with the Nordwest Hospital of the Nordstadt Hospital in Hannover. And then he got also the chair in neurosurgery at the town of Hannover. But let me say a few words of the particular career of Madjid Sammi in my department. He started in 1966, and it was 64, excuse me, and he was 13 years in my department in Mainz, and he started very early with peripheral nerve surgery. He got to Professor Milesi in Vienna, a well-known man of the hand surgery, and learned the first steps in peripheral nerve surgery in the modern art of the micro technique, with also with grafting of nerves, and then he started in my department with an excellent, I must say, I was very proud of him, because he started at first the experimental work, and after the experimental work of grafting of peripheral nerves and the interfascicular suture and so on. I will not go into detail. And with this work, he got, in a very short time, an international reputation in my eyes. And then in the 70s, I think the first course was in 1970, and it was the idea of Madjid Sammi to give this experience to the younger generation and to all neurosurgeons in Germany and then from outside in Europe, and also to the overseas.
May I interrupt you? It was not only to give your experience to the young, but also to the elder generation. And I remember well that I attended this course and that I learned from you the technique of the interfascicular nerve suture. I could do the old-fashioned nerve suture quite well, and I have done it in several hundred cases before. But this new suture technique and the grafting technique, I have learned from you at this course.
I remember very well in 1970, you, Fritz, has participated in that course, and very carefully observing all the new possibilities for nerve repair under the microscope. And I think you are one of those neurosurgeons who has at that time extremely positively influenced my activity. I hope you remember, you told me, wonderful, go on, this is the future for peripheral nerve surgery, and the result, I am convinced today that the result will be in future much better. And I have to thank you for your comment at that time.
I'm glad that I succeeded in encouraging you.
Thank you.
Yes,
but go on, Kurt.
Yes, it was a time for me very interesting too, because that we can give the experience to the other two colleagues of us. And I remember very well that the organization work was not so easy to do, because we need in our laboratories, we had 7 laboratories only for research work. And it was to organize that we receive 30 microscopes, and we built then groups, only two persons at one microscope, and they could train then this work. Also the vascular surgery, microvascular surgery in rabbits, a whole week. But I want to go on further on. And then we started later with the skull base, as you know, to bring together ENT surgeon, maxillofacial surgeon, neurosurgeons, because that was the idea that the skull base is not a barrier, but a common field of working of the various disciplines who are around, intracranially, extracranially. And that was, for me, in the last 10 years, one of the greatest experiences. And it was a real pleasure that we can go together this way. It was also in this time that the transnasal and transphenual approach had, let me say, renaissance. Because everybody knows that Cushing, Hirsch, and other very great personalities had operated the pituitary adenomas in that way. But in Europe, we are a little bit late in this field. And Fritz Loew, I remember very well, he went to Guillaume at Paris to learn this method, because Guillaume was the first European who had a lot of experience in this field. And then I sent my pupil, Madjid Sammi, to Loew and look for this, because I think it is a good way that we can do the both ways. That means the transnasal and transphenoidal, and also the transcranial approach. And we must find out also the indications for this. The successful activities in the peripheral nerve surgery led to the cranial nerves too. And that was at the skull base, and the skull base study group has the beginning in that time. That means that was in 1973, 74. And I think you should say some words to the reconstruction also of the trigeminal nerve and the facial nerve and other cranial nerves.
Kurt, I remember that you have mentioned about our courses. You know, we have started to organize the macrosurgical courses every year twice, and we have started to open the way for reconstruction of cranial nerves. You have mentioned that the facial nerve was in the center of our activities for cranial nerve. Everybody knows that how often the facial nerve is involved, for example, in acoustic neurinomas. And I was so happy that you have very often encouraged me to try, even in those cases in which we were not very enthusiastic about the outcome of the patient, to do the graft for reconstruction of facial nerve. We have done at that time, and these results was the cause for our encouragement to go further with the activities, particularly at the skull base. And I think one of your great contribution, Kurt, to surgery in and around the neurosurgery, I must say, skull base, you have mentioned, was a barrier between different surgical disciplines. But I believe you have opened all the ways for all our colleagues from other disciplines to come together. You have prepared a very nice friendship between the different specialties, that we could work on this very, I must still say, complicated and not so easy field. And so after a short time, you have mentioned that we saw that we need a study group. And you were, as I remember, we have officially established the International Skull Base Study Group in the late 70s, and you have been then elected as the first president of this group. And the skull base then started to grow and grow and grow. And you know, we have organized then not courses on only macrosurgery, but every year we organize courses on the skull base surgery and invited people not from neurosurgical field, but also from the other surgical discipline as ENT, ophthalmologist, and also maxillofacial surgeon.
Anatomy.
And you are right, we should not forget in this connection the contribution of the anatomist to the skull base. In this occasion, we should say that we are very thankful to our friends, Professor Johannes Lang from University of Würzburg and Professor Pierre Rabichon from University of Montpellier. As you know, in the meantime, the majority of countries in the world have also established such skull-based study groups or societies, and now it is great pleasure for us that next year the first World Congress of Skull Base will take place in Germany, and we are
At
expecting
Hanover.
I hope in Hanover, and I think these development all, I think, based on your help and your efforts and your encouragement to all the people who were involved at that time.
Yes, but I should add that this work which Jukort started has been led on by you, Madjid, and now you are one of the leading men in the field of skull-based surgery. That's without any
Of course, that is.
Thank you, Fritz. I
no
thank
doubt.
you for this compliment, but I am convinced that the masters, they play a great role for the future. Without masters like Kurt Schurmann and also in many fields like you, I believe the next generation could not be successful, and therefore is our duty also in future, and that is also my desire to all people who are now leading the neurosurgery to open the way for the young people in future.
That is very good. I must say that I can now explain what great pioneers in Germany lived many, many, many years ago.
Therefore, if you allow me, I take now the opportunity to introduce our friend Fritz Loew to our audience. Fritz is born in the same year as you were born,
1920.
1920, and he was the pupil of our master in neurosurgery, of great founder of modern neurosurgery in Germany, Tonis, and he has already started in 1945
45
in neurosurgery in Bochum-Langdreh. And then you moved also with Professor Tonis to Cologne, and it was, I think, 1951. And 1 year later, you have been elected by him as vice director of the clinic. Oh, that was in 1952. Now, almost 40 years you have been in leading position of neurosurgery, and then you moved from there to Homburg, where you have started in 1960. And you started, I must tell you, for some people who don't know about that time, the same has done Kurt Schurmann in Mainz. You and Kurt, you have started with 2-3 beds.
Six.
You have started with 6, and I
I
remember
started
you
with
had 3
3.
beds. And this is unbelievable to start today, start with 3 beds and do the neurosurgery. And you have then continued and developed the department and up to 80 beds of neurosurgery in Homburg. And you
When I retired, I had 90 beds.
Oh, you had 90 beds. This is, of course, a number which is really very, very acceptable for a neurosurgeon. And beside of your clinical activities, you have also you have been members and founding members of many societies, and also you have been since 56 chief editor of Acta Neurochirurgica, which is the official organ of European Association of Neurosurgery, and you were also one of the founding members of European Association. And also, last but not least, you have been elected in 1989 as the honorary president of the World Federation of Neurosurgical Societies. They are the acknowledgement of the societies to you, but your your neurosurgical career was connected with always with early beginning of the problems. For example, in Germany, I remember you was one of the first who has started with a macrosurgery. You saw that the macrosurgery is very important for the future of this field. Early 60, you have started to use macroscope, and in this connection, perhaps not many people knows that you are one of the first who has done the reconstruction of facial nerve, the so-called dot operation, under the microscope together with ENT surgeons, early 60s, and with good results. And the same was the introduction of macrosurgery to the disc rupture. You have started to use the microscope for removal of disc ruptures, and you have demonstrated that the results using the operating microscope is much better. You can preserve the nerves, you can perform a better removal of the disc, and the surgery is connected with less lesion if you use the operating microscope. But I remember that in 1969, I heard Professor Schurmann told me at that time, yes, Fritz Loew is doing the pituitary surgery now in the recent years through the transsphenoidal approach, and he has learned this approach by Loew in Paris and doing in Homburg. And you were also in Germany one of the pioneers who started to use the microscope and use the transsphenoidal approach. And then he told me, go and see how is his technique, and we will perhaps start with this technique in Mainz. I came to you, and I enjoyed your hospitalities, not yours, but also your wives and your family. Spent very nice time with you in Homburg. And I came back, and I remember that in 1900, Kurt, you must remember, in 1970, we have then done our first
I remember very good. Yes, that is a nice story, I must say.
You remember, I started and put the microscope and went through the sphenoid and exposed the cella, and then I called you and said, Professor, at that time you Chairman, I said, Professor, everything is ready, please come and see the view through a sphenoid of the pituitary adenomas.
And then that comes the story now. There comes a call from the obstetrics clinic.
At the same time, as I was operating.
When I was looking for, and it was a nice survey through the microscope to the pituitary adenoma, and then comes a call from the obstetrics. Hello, here is born the son of Professor Sammi.
Yes, that was, I remember.
And you were in this time so engaged that you preferred to operate the transsphenoidal route to the pituitary adenoma, and had forgotten that the sun is on the way. And Amir comes, it was the birthday of your son, Amir, who is now also engaged in medicine and also in neurosurgery. But I think we have to follow on the way. Are you ready with the introduction of our friend Fritz Loew?
Yes, I think Fritz, in general, I believe that you have contributed a lot, not only for German neurosurgery, but also to the development of neurosurgery in all over the world. And I have to thank you in this occasion for all of your effort.
Thank you. Yes, but we are speaking too long about the actual situation and about our own history, I think we should go back into the basics of German neurosurgery. And what do you think, Kurt? You start?
Yeah, I think we have to went back in the past and to nominate some pioneers, real pioneers in the field of neurosurgery in Germany. It was the first craniotomy was done in 1882 by Hahn, that was a general surgeon, and Hahn was directed by Otto Wernicke, a great personality in neurology. And he removed a deep situated tuberculoma of the occipital lobe, and the diagnosis was done by Wernicke by the homonymous hemianopsia. It was 2 years before when Bennett and Goodley in England removed a glioma in the fissure of Orlando. 2 years before. And it was was in my eyes the start of neurosurgery in Germany. And then in the following time there were in my eyes four periods, and these periods are connected with the names of pioneers. That is at first Ernst von Bergmann, and the second was Fedor Krause, the third was Ottfried Förster, and at fourth Wilhelm Tonis. He started with the modern neurosurgery, and Tonis was the man who has given the neurosurgery as a specialty with the independence of other disciplines. However, let me say some words to the very, very early time, Ernst von Bergmann. I think not many people knows him, but he was an excellent man. He was the father of asepsis in Germany. He introduced the aseptic procedures in the operating room in 1886, very, very early. And then he started also with studies on intracranial pressure, on infections, brain infections. And he presented in 1889 a series of successful treated brain abscesses. And then he published on intracranial pressure, on brain abscess, and so on. And therefore, one can also say he is the old father of neurosurgery in Germany. And after him comes Fedor Krause. Fedor Krause started in 1892. He started with the exposure of the middle fossa, the extirpation of the Gesserian ganglion in the trigeminal neuralgia, and then it follows nearby year by year new approaches which are also today in use to the anterior fossa. I think it was 1898. He removed a projectile after a gunshot injury from the floor of the anterior fossa and looked inside and see there is a chiasm. We can use this approach for pituitary surgery and so on. And this was the way of the excellent thinking man Fedor Krause, and and he introduced the unilateral approach to the acoustic neurinoma.
Yeah, you are right. I think many people don't know that.
Yeah.
That Krause was the first who has introduced the unilateral approach to CP angle.
An
Even
ingenious man.
before Cushing and before Dendy. It should
Yes,
be
of course.
remembered.
It did it. And
But wasn't it right, Kurt, that you have been bestowed with the Theodor Krause Medal, honored by be giving the Theodor Krause Medal by the German Society of Neurosurgery some few years ago?
yes, it was 2 years ago, no, or 5 years ago. Yes, I was bestowed with this medal, and I am very, very happy on this. And as you remember, Wilhelm Tonis, our teacher, has introduced the Theodor Krause medal and Ottfried Förster medal in 1950. Is it right? I think it was the
maybe
very
50, 51,
nearly
too.
after the.
Yes.
It was after the foundation of the Deutsche Gesellschaft für Neurochirurgie. A few months later, he said, and I found that this word was very good. We all are standing on the shoulders of the pioneers, and Theodor Krause was such a pioneer. And after Theodor Krause, it was in the time between 1890 to 1920. And then comes Ottfried Förster as a neurologist. And he was an excellent, a leading neurologist. And he has a friendship with Jürgen Jackson and Sherrington and so on. He was international, he has international connections. And Ottfried Förster was a neurologist. And then during World War I, he was not content with the not fine enough, not delicate enough operations of the general surgeons. And then he started in 1917, at the end of the war, with the peripheral nerve surgery, and he was self-taught. As a neurologist, he started with his neurosurgical career. It was very interesting.
Kurt, the nerve grafting we started under the microscope was in 1916. Förster has used the sural nerves and as a graft for bridging of lung defect with a fantastic result. This is unbelievable. In 1916.
It is very interesting to look for this, because after World War I, he has collected 4,900 cases of peripheral nerve lesions and has examined these patients, everybody for himself, and he has published the results of his examinations. This is a standard work of Ottfried Förster. And then in the neurosurgery, in 1908, he was a neurologist, not a surgeon, but he stimulated the surgeon teacher in Breslau, as I remember, for the cutting of the dorsal roots in chronic pain diseases and in gastric crisis and so on. And in 1913, he gives advice to do the cordotomy for chronic pain. That means the section, the cutting of the spinothalamic tract
from
within the cord.
From the cutting of the nerve roots, he developed the knowledge of the segmental innervation, not only on the sensible way, but also later on the motoric way.
Yes.
And all these maps we use nowadays for segmental innervation are based on this work of Ottfried Förster.
Yes, he was a brilliant man, of course. And in sure, but in 1930 he went to Cushing and to see what is done there, and he was invited, as I know, from Harvey Cushing, and that was a so-called professorship, or he leaded in this time the department of Harvey Cushing, and it was a real friendship, more or less, between them. But Harvey Cushing had introduced in that time the electrocauterization, electrocoagulation for the bleeding, and also the silver clips. Förster came back to Breslau, but he doesn't need his whole life silver clips and electrocoagulation. He made the stopping of bleeding with muscle pieces in the old way, but he succeeded, and I must say that in 1928 he introduced the supratentorial approach to the quadrigeminal plate and succeeded in a removal of a tumor on this region. And Fedor Krause did it in 1913, as I think,
About that,
with a suboccipital approach, infratentorial. Both operations were the first in the world, I must say it, and therefore I must say once more that we are standing on the shoulders of our old pioneers. And the fourth period after Otfried Förster was started then by Wilhelm Tonis, and I think that Fritz Loew will give us some explanation. He started with a Rockefeller grant, Rockefeller from the Rockefeller Foundation. He went to Oliver Kroner in Stockholm, and when he came back to Würzburg, then he started with the neurosurgery.
Yes, it's true. In 1932, Wilhelm Tonis, who was a general surgeon, got a sponsorship by the Rockefeller Foundation, a grant, to go to Herbert Oliver Kroner at Stockholm. Oliver Kroner himself has been a pupil of Cushing. And you see, by this way, Tonis became grandson of Harvey Cushing. It was one of the preconditions to join Oliver Kroner that he first had to learn the Swedish language. And the other precondition was that he first had to work in neurology. And only after having done both of these preconditions, he went into Herbert Oliver Kroner. And I remember him telling me that when he arrived, Oliver Kroner told him, "Oh yes, we have a meningioma and you just can assist me by this operation." And this operation lasted about 8 to 10 hours. And after this operation, they went out of the operating room, but about 1 or 2 hours later, there was a bleeding. And then they had to reopen, and then the next step of this operation lasted again about 8 hours, and he was duly impressed by the workload of neurosurgery at that time. We are happier nowadays. When he came back from Stockholm, he founded the first independent neurosurgical department within the Surgical University Clinic of Würzburg. And within a very short period, he collected such a huge material of brain tumors that his material, after about 2 years, was larger than the whole material which Ottfried Förster had collected during more than 10 years' time. In 1936, there was a joint congress of the British Society of Neurological Surgeons with the German, the few German neurosurgeons, let's say, with Wilhelm Tonis and with Ottfried Förster. And this congress took place partly in Berlin and partly in Breslau. At that time, Tonis just had got a chair of neurosurgery in Berlin and had founded the first neurosurgical university clinic of Germany. It developed a very close cooperation with Jefferson and with Bailey and with Vincent from Paris and Pallado, and all these men together, but under the leadership of Wilhelm Tonis, founded the Zentralblatt für Neurochirurgie in 1936, 1937, which was the first specialized journal of our specialty. His career was not interrupted, but greatly influenced by the Second World War. And he became one of the leading medical doctors within the military organization. He was not a Nazi, but he was interested in helping the wounded soldiers, and therefore he cooperated with them, and he organized, which was the first situation in the world, he organized the direct transfer from head-injured patients to specialized units where they got their first treatment, and even organized the rehabilitation centers in order to be able to supervise and help those brain-injured patients to enter the social work. Please.
Let me add it. He was a general doctor in the FAs, and therefore he could organize the transportation of the head gunshot by aircraft. That was the background.
And I remember
also here money.
Oh yes, they had money and they had equipment, and therefore it was possible to create such an exemplary organization. And I remember well that after the catastrophic end of this World War, the Americans said that some few developments of the Germans had been really good. One of them has been the development of the rockets. And the other one had been this organization of the head-injured patients, bringing them back by aircraft from the front line to the specialized units and later to the rehabilitation centers. After this disaster of this World War, Tonis started working first in a miners' hospital in Bochum. But he combined this miners' hospital with a Max Planck Institute for tumor research and experimental brain pathology together with Zülch. And together with Zülch, they worked on a refinement on the classification of brain tumors. And he worked on intracranial pressure studies. He worked on a classification of the closed and of the open brain injuries. I had the privilege to cooperate especially on this topic with him. and quite sure that he developed a lot of new steps in the treatment of intracranial tumors and on vascular diseases of the central nervous system. In 1952, he founded the Handbook of Neurosurgery together with Oliver Kroner and with some of his staff, which for looking for the past literature is even nowadays a very important source of knowledge. As already has been mentioned, he founded the Deutsche Gesellschaft für Neurochirurgie in 1950, and he founded an association of all doctors of neurosciences, the so-called Gesamtverband Deutscher Nervenärzte, together with the neurologist Heinrich Pette in 1955. In order to honor the founders of German neurosurgery, as Kurt already mentioned, he proposed the creation of the Theodor Krause Medal and of the Ottfried Förster Medal, following a quotation by Hans Sachs from the very famous Wagner opera, the Meistersinger, which means, ehret eure großen Meister, dann bannt ihr gute Geister. In bad English, honor your great masters, and you will then capture good spirits. I should insert the remark that all three of us have English not as our mother language.
Yes.
And therefore, please, we apologize for our bad English and we beg your pardon, but we can't do it better. Yes, Tonis was the man who reached the great breakthrough for neurosurgery in Western Germany. And almost all of the chairs of neurosurgery, which have been created in the 1950s and 1960s, are created by the encouragement of Wilhelm Tonis and have been given to his pupils. And that means that most of this first post-Second World War generation, to which both we belong, have been pupils of Wilhelm Tonis. And the actual generation of neurosurgery, who are still active, who are still leading further on our specialty, are our pupils, like, for instance, Madjid Sammi. Tonis created, or he gave a donation after his retirement, the so-called Wilhelm Tonis Stiftung. And this donation gives grants to young neurosurgeons to go outside Germany and in order to study special scientific methods and techniques. And this foundation really very generous supports the younger generation of neurosurgeons. Yes, I think this are the main lines of Wilhelm Tonis and of the his merits for the development of German neurosurgery, and that means now we are coming to the present and to the future. I think the future, the possible future, should be explained by Madjid Sammi because he belongs to those neurosurgeons and to this generation who will create the future. Please, Madjid, what do you think?
Listening to you, Fritz, and also to Kurt, when you were talking about their first and second generation of pioneers, you have mentioned Ernst von Bergmann, Fedor Krause, Förster, and you mentioned about Wilhelm Tonis. We have seen that they have paved the way for you, for your generation. If you remember, without pioneer works of Fedor Krause and all these approaches, and also Förster, and also without the great efforts of Tonis in your generation, you couldn't practice the neurosurgery so successfully. And I personally had the chance that my honor teacher, Professor Schurmann, was not looking only at his time he were working in neurosurgery, but his vision was looking to the next 20 years, 25 years. And that means that our duty is not only to solve the actual problem which we are confronted with, but in the same time, we have to have a vision over this period and look what will happen in 20 years. So I had the chance that my teacher helped me to prepare myself for the neurosurgery in this time. So therefore I am thankful to my teacher, and this is our duty now in our age, in my age, all my colleagues in all over the world, to look that what we are doing now is not good enough for neurosurgery in 20 years. Now, if you ask me what is the state of art today in neurosurgery, I would say we have achieved through introduction of macrosurgery, and with the increasing knowledge of macroanatomy in the very complicated anatomical areas, we have been able to solve many surgical technical problems. We have developed many proper instruments which help us to manipulate the structures without traumatizing them. So I believe that today, after 25, 30 years macrosurgery, we have already reached the limit of our manual surgical abilities. We can handle all the structures in a proper way. We can do the surgery very carefully with patience and cautions, and we can preserve nearby all the structures during the surgery. But there are many problems left to solve which are not connected directly to the surgery and the manual abilities. In order to bring one example, we know that, for example, meningiomas are benign tumors, slowly growing pathology, but we have learned that at least 20% of these meningiomas, they are, despite of their benign growing, that means slowly growing, they have a malignant behavior. They infiltrate the structures. They grow and don't respect arteries, nerves, dura, and if they reach cavernous sinus, they grow through the cavernous sinus to the orbit. So we must say that in these 20% of meningiomas, we have to stop with our manual activities, and we cannot help anymore the patients. So you see that biological behavior of these even benign tumors is still a problem for us to solve. Therefore, I believe that the future of neurosurgery in 20 years will be the help from other side. My feeling is that we need top molecular biologists who are working on the behavior of the cells, of single cells in different tissues in our body.
I could imagine that this applies not only for the meningiomas, but also and especially for the gliomas.
Absolutely. Gliomas is still within the last 30 years, we have not changed anything in the outcome of gliomas. This is the same problem. So I believe that the involvement of molecular biologists, more than we have done in the past, in future, is one of the very important contribution to neurosurgery on the one side. On the other side, if you look at the industry and see that computer technique and artificial intelligence has found a great place in the industry, and we are not using all these achievements in the neurosurgery, so I am surprised about that, why we are not bringing these top people from the technology also to the neurosurgery and start to create a new way of neurosurgeon life. So I believe that in 20 years, we will have every neurosurgeon is not working alone with his hands and with his knowledge of anatomy, but he's working with top people in technology and also people with a highest knowledge of molecular biology. This is my desire for future, and I am sure this is the only way that our pupils who are in the age of 30, in 20 years, when they are leading in neurosurgery, they have the benefit of this cooperation.
Madjid, to make it concrete, you mean, for instance, development of expert systems. Could be one point. You could mean, or you mean, I'm sure, the three-dimensional reconstruction of the intracranial space during the operation, to see at the monitor what you are doing inside.
A control system.
A control system. And even a helping system. The computer-guided movements for the handling of specially sensible structures. I think these are some of the points of the technological development which is coming to us. And then I only can underline and have to underline this cooperation with the biological sciences, with the biology of brain tumors, better to gain better knowledge about that, the possibilities to get markers, to develop markers and to clone markers, not only for diagnostical but also for therapeutical purposes.
But you can use also, you can color by biologists the structures during the surgery. Today is not a problem to color the pathway, the nuclei, and some regions in order to differentiate between pathology and the normal tissues. This is something which could introduce very, very soon in the neurosurgery.
Yeah.
And then I think you didn't mention it. I think that the grafting, the transplantation within the central nervous system will become more and more important. And there are a lot of possibilities which we only can have the first feeling for. And then it's possible to develop new materials, let's say for the replacement of vertebral bodies, for instance. And by this open better possibilities to remove large pathologies within the spine. But you also have ideas.
I think that was a very good final remark, and we have to close very soon. But I must say that, in my opinion, that this way, I hope that the future will bring up something, because all generations had not solved the problem of the gliomas, not with X-ray, not with operation, not with combined therapy, chemotherapy, and so on. And if the neurobiology will give some advice to find the way out in the next 20 to 30 years, I want to see it from the heaven, to look for this, because the glioma surgery was for me one of the baddest things during my whole life. But you have to operate and to have to help and so on. And if this way with the neurobiology will also give an advice for finer and more delicate operation, yeah, must be a fine thing. That I think we cannot look too much to the future, but I'm sure that you will have and find many, many problems in your whole life and during your whole neurosurgical life. And I hope only that you all can solve problems which we couldn't solve.
I'm sure we have left so many fascinating problems
Really?
that if I again would be young, I would start being a neurosurgeon.
Wonderful.
Okay, fine. Yeah, I too.